Finally, a grim milestone as the death toll from COVID-19 in the United States tops 1 million since the beginning of the pandemic. But as the pandemic continues to carry on, what does the future hold regarding federal policy on COVID funding, mask mandates, and vaccinations? Joining me now is Dr. Robert Parisien. Doctor, great to have you with us and in the studio. I want to start by getting your reaction to the number 1 million. It's a big one.
Yeah, 1 million is certainly a huge sort of somber moment, I think, for us in the sort of global pandemic against COVID-19. Here in the United States, 1 million lives have been lost and families have been affected and many millions more around the country. So I certainly think this is a time to sort of reflect on that and then discuss what we can do moving forward.
COVID-19 is not as prevalent in the headlines, I guess, in the past few months as it has been, because we had been talking about the surge in Omicron cases. And that was, I think, the last big time that we really had a spotlight on the virus itself. Now this has branched into some different strains, and it seems to me that the virus now is less severe.
So the term that you use that's interesting is prevalence. And so we use that a lot in medicine and in epidemiology and statistics when we're evaluating this. And I think it does come down to definition. So when you talk about a prevalence of a disease, that is the amount of disease that you have in society at a given time point. Then incidence, which many folks have been hearing about, those are new cases. And these are ways in which that we can track disease processes. And so we know that the disease, for example, COVID, had a much higher incidence with cases back in December and January, for example. We had 800,000 or so new cases at that time of an incidence of it. We're down to about 100, 150,000 cases. Now, as you mentioned, hospitalizations and death rates, those are two very important metrics to be watching right now. Because if you look at H1N1, the swine flu virus of the past, that was very contagious, but it wasn't so virulent. You didn't have a lot of hospitalizations and increased death rates, for example. So even back in February and January, we had death rates per day of about 3,000. And now we're down to about 300 deaths per day. So we're in a very different place. And largely that's probably because, greater than 80% of Americans have at least one vaccine. There's a lot of infectivity, meaning a lot of people in the country have been infected by COVID. And then also the Omicron variant seems to be highly contagious, so it's easy to spread it from myself to yourself, for example, or anybody else, but it's less virulent. It's not as harmful and dangerous as the other variants.
When we hear this number, a lot of Americans may still be wondering what the future of the coronavirus pandemic is and if we know when this is going to become endemic.
That's a great point. So, we are right now, as I said, and from a definitional standpoint, we certainly are still in a pandemic, meaning you have a virus that is throughout the world. That is the definition of a pandemic. Increased levels of virus above what would be normal levels across the world. So we are. But I believe we are now, we've worked our way into this sort of endemic phase. And an endemic phase sort of means you have a baseline level of disease and virus that is circulating within a population, a specific population, so say here in the United States. And then you get into sort of the endemic management of the disease. And that's where we talk about people and individuals and communities and societies making decisions based on risk assessments. You know what I mean? Are they gonna gather? I've talked about NASCAR events, and we had the Masters that was recently happened, and the Oscars and the Grammys, and all of these individuals are making their own risk assessment whether they're going to gather without masks, for example, and going forward in the future.
Really quickly, what do you think the future looks like with mandates? Obviously, the federal transportation mandate has been a really hot topic in terms of whether people should be able to take their masks off. I mean, that's still being battled out in court right now.
Mm-hmm. Yeah, and I think we'll probably continue to see that being battled out. But from a medical standpoint, as we touched upon, I think the most important things that we need to look at are our hospitalization rates and our death rates. And as long as our hospitalization rates are down at a reasonable number, and we don't have a direct threshold number to go by, so I wouldn't put a number out there, and death rates as well. But for example, I'm a team physician for USA Fencing, and USA Fencing has just lifted the mandate for masks to be required for the fencers during competition. And so I think we're going to see a lot of these mandates go in that direction as long as we are in this endemic phase where the hospitalizations and death rates remain low.
Dr. Robert Parisien, thanks for closing the show with us. We appreciate you being here in the studio. That's going to do it for this week's edition of Saturday Agenda. I'm Kilmany Dukart. I'll see you back here next week.